My dear friends, I am Dr. Omkar Prasad Baidya. Today I will be discussing about colorectal carcinoma, various sign symptoms, how to diagnose, and what are the treatment modalities for colorectal carcinoma. Now, colorectal carcinoma is a cancer of the colon and rectum area. Colon is the lowermost part of the gastrointestinal system, and it is divided into various parts like ascending colon, descending colon, sigmoid colon, and rectum also. Now, the innermost lining of the colon, because of various irritation or exposed to chemical substances, and those who are at higher risk may undergo the normal cells of those areas or in lining of the colonic area may undergo abnormal changes and leads to formation of abnormal cells which undergo changes and may form polyps. Now polyps may be there or for 10 to 15 years. Polyps may remain there for 10 to 15 years, and after that it may convert it into colorectal carcinoma. So colorectal carcinoma can be of various type like adenocarcinoma, which is the most common, and it is originated from polyps. So presence of polyps in the colon may be one of the important risk factors of development of cancer of the colonic region as well as rectal region, and 80 to 90% of the cancers of the colorectal region or colorectal carcinoma is presence of polyp. Now there are two type of polyp. What are those? One is adenomatous polyp and other one is hyperplastic and inflammatory polyp. Now adenomatous polyp is responsible for conversion into carcinoma or malignant tumor, but hyperplastic polyp as well as inflammatory polyps are mostly benign and they don't undergo any malignant change. So adenomatous polyps, presence of adenomatous polyp is mainly the increased risk of getting colorectal carcinoma in future. So again I am telling there are three various types of cancer of the colorectal region. Number one is adenocarcinoma, that is 90% or majority of the cancers of the colorectal region is adenocarcinoma, and it is from adenomatous polyp, which is the most common type of polyp which may ultimately give rise to adenocarcinoma of the colon. Besides there are other carcinoma like carcinoid syndrome, then gastrointestinal stromal tumor which involves the interstitial cells of Kajal, and it present with various syndrome or sign symptoms. Then there is sarcoma, then lymphoma, and so on. And out of this all these types of cancer, adenocarcinoma of the colon is the most common type of colorectal carcinoma. Now there are so many important risk factors like smoking, then alcoholism, then family history of colorectal carcinoma, then familial inherited disorders like familial adenomatous polyposis, then Page-Jaeger syndrome, Tarkos syndrome, Gardner syndrome, then presence of adenomatous polyps in the colon. So these are the various risk factors. Beside, some age also matters, because those who are higher ages after 50, the risk of colorectal carcinoma gradually increases. Beside, presence of overweight or obesity, hypertension, then various GI disorder, gastrointestinal disease like ulcerative colitis, Crohn's disease, they are more prone to develop colorectal carcinoma in future. Now, to prevent the colorectal carcinoma, the most important test or preventive measure is the early diagnosis of the polyps through colonoscopy or removal of the polyps via colonoscopy. So removal of the polyps, it may be one of the important protective measure to prevent the risk of getting colorectal carcinoma. Now today I will be trying to focus on the various sign symptoms of colorectal carcinoma. The colorectal carcinoma in early stage may not be present with any sign symptoms, but it may be some changes may be also be associated, and we call it earliest sign symptoms of colorectal carcinoma. So what is the earlier most sign symptom or earliest sign symptom of colorectal carcinoma? That is persistent change in bowel habits. That is the patient may suffer from diarrhea with altered constipation or constipation and diarrhea. What I mean to say is that whatever the person bowel habit, it becomes altered with time. So gradual altering in the bowel habits of a patient can be one of the important earliest sign of development of colorectal carcinoma. Besides, rectal bleeding or blood in the stool may be another important clinical feature or sign symptoms of colorectal carcinoma. Besides that, there may be abdominal discomfort, pain, then gas production. All those things may be associated with colorectal carcinoma. Beside, feeling of incomplete evacuation of bowel or incomplete evacuation of stool. The feeling of the patient may feel that he is not able to pass the stool completely, so there is some incomplete sensation of bowel evacuation. So that may be another important sign symptoms of colorectal carcinoma. Beside weakness, fatigue, those things the patient may also complain of weakness and fatigue, because many cancers are associated with weakness and fatigue. Beside, unexplained weight loss may be another important sign symptoms, but it is not only for colorectal carcinoma, it is almost present in all other cancer also, that weight loss may be part and parcel of various type of cancers. So these are the various sign symptoms of colorectal carcinoma: rectal bleeding, blood in the stool, then alternation in the, or change in the bowel habits, then feeling of incomplete bowel evacuation, abdominal discomfort, pain, gas production. All those things are various important sign symptoms of colorectal carcinoma. Now, how will diagnose? Now, there are lots of technical method by which we can diagnose. The most important is the colonoscopy. Colonoscopy is responsible for early screening, early diagnosis, and also for colorectal screening method. Now, colonoscopy uh, is a technique by which an endoscope-like structure, which is guided by a camera, is introduced through rectum, and which may entered or push forward up to the level of colons, and there it see the presence of any dysplasia, polyps, any growth, any tumor, and so on. So colonoscopy can easily diagnose presence of polyps, and if polyps is present, the patient may go into a prophylactic polypectomy surgery so as to prevent the risk of development of colonic carcinoma in future. So colonoscopy can be one of the important diagnostic method by which physician or doctor can diagnose colorectal carcinoma at early stage, at very early stage. Next one is biopsy. After the person has undergo colonoscopy, the person can go for biopsy of the polyps if they found positive or presence in the colon through colonoscopy. So colonoscopy findings, if they found presence of polyps, then the polyp may be sent for biopsy, or biopsy can be done for the polyps, and through biopsy it can be examined whether it is a malignant or it is benign, or nature of the polyp can be analyzed. So mostly the adenomatous polyps are at higher risk for development of colorectal carcinoma. Otherwise, inflammatory and hyperplastic polyp, they does not give rise to colorectal carcinoma in most of the cases. Besides, molecular testing of tumors methods are there. By these techniques also we can diagnose colorectal carcinoma. Then we have blood test, carcinoembryogenic antigen, CEA. So CEA or carcinoembryogenic antigen is one of the important blood biomarker for diagnosis of colorectal carcinoma. It could also help in prognostication. Not only diagnosis, it also helps in prognostication, but carcinoembryogenic antigen can also increase in some other diseases also. Besides, there is CT scan for advanced for stage. If there is a metastasis or spread of the colorectal carcinoma in other parts of the body, then CT scan and MRI, they are imaging technology, can play an important role. So CT scan and MRI can find out if the disease has spread to other parts of the body, or for an advanced stage of the disease, the CT scan and MRI can give diagnosis. Besides, ultrasound can also find out the presence of polyps, or in case of presence of any colorectal carcinoma, it can diagnose. Sometimes chest X-ray can be advised, because it is also a diagnostic in case the colorectal carcinoma has spread to pulmonary system or lung. So chest X-ray may show some metastatic changes in the lung in case the colorectal carcinoma has spread to other parts of body or organs like lung. So these are the various type of tools by which diagnosis can be done, and most important is colonoscopy because it is associated with early screening of colorectal carcinoma, early diagnosis of colorectal carcinoma, or diagnosis of colonic cancer at very early stage, or diagnosis of presence of polyps is through colonoscopy only. And if the colonoscopy shows presence of polyps, and patient, then doctor can advise to the patient so as to go for polypectomy, so as to prevent the risk of development of colorectal carcinoma in future. So these are the various methods or diagnostic process by which we can diagnose colorectal carcinoma depending on the staging of the or degree of colorectal carcinoma. Now we will discuss about various treatment modalities. Now, for early stage of colorectal carcinoma, and if there is presence of polyps in the colon, then polypectomy can be done. Polypectomy simply means the removal of the polyps by surgical method, and removal of the polyp may be important preventive measure by which we can prevent the risk of development of colorectal carcinoma in future. So polypectomy can be advised in those subjects who are showing the presence of polyps via colonoscopy. Besides, there is other techniques like endoscopic mucosal resection. So if the mucosa of the colonic area or colorectal region shows some dysplasia or carcinogenic changes or cancer changes, then by endoscope mucosal resection can be done, and we call it EMR or endoscopic mucosal resection. That is done in very early stage of the disease. That may be a part of surgery or surgical therapy for treatment of the very early stage of colorectal carcinoma. Another important tool or surgical method for treatment of early stage colonic carcinoma is laparoscopic surgery or minimal invasive surgery. Through laparoscopic surgery also polypectomy can be done, or removal of that tumor mass can be done if the tumor has not spread to other part of the body. That time minimal invasive surgery or laparoscopic surgery can be play an important role in treatment of the early stage of the colonic carcinoma. Besides, if the disease is diagnosed or colorectal carcinoma is diagnosed at very advanced stage, then we have to remove the colon. So that is called partial colectomy, and reconstruction of the rectum has to be done so as to allow the person to undergo the excretion of stool. So that's why that new technique is called partial colectomy, where a part of the colon is removed depending on the area which is involved for cancer, and we call it partial colectomy. It is an advanced surgical method in those cases or more advanced case of colorectal carcinoma. Besides, there are chemotherapy. Chemotherapy means the anti-cancer drugs are also applied along with surgical methods so as to prevent the relapse of the disease or spread of the disease and prevent the growth of the tumor. Besides, there is radiotherapy. Radiotherapy is very much sensitive because it can damage the cancer cells or tumor cells, or it can even kill the polyps or hyperplastic polyps, and thus it can prevent the progression or growth of the cancer or metastasis to other places. There is another term known as targeted drug therapy. Here, drug can be targeted with some special means, and especially chemotherapy drugs are used here, and the drug will fight against the tumor against which the drug therapy is targeted, and this phenomena is called targeted drug delivery. Besides, there is immunotherapy also. In cancer, there is immunity shutdown. So if immunotherapy is done, it may boost our immunity to fight against the cancers, especially colorectal carcinoma. So these are the various modalities of treatment of colorectal carcinoma. So for prevention, we can go for polypectomy, and colonoscopy or colonoscopical technique is the most important diagnostic tool for early detection of colorectal carcinoma. So if presence of polyp is there, then prophylactic polypectomy can be done so as to prevent the development of colorectal carcinoma. Besides, patient may go into endoscopic mucosal resection, then colectomy or partial colectomy can be done. Besides, other treatment modality like radiotherapy, immunotherapy, Then chemotherapy, targeted drug delivery, all those things are also there, so as to prevent the progression of the disease, so as to kill the tumor cells, as well as prevent the spread of the cancer to other parts of the body, or to prevent metastasis. Thus, these are the various treatment strategy. And when it comes to diagnosis, colonoscopy is a diagnostic tool. Then biopsy is also important. Beside, for those colorectal cancer who is spread to other parts of the body or in advanced stage, CT scan or MRI can ultimately help in diagnosis of the metastasis as well as growth of the tumor, and diagnose the involvement of the colon and degree of involvement. So MRI and CT scan becomes important when the colonic carcinoma spreads to other part of the body, or it is diagnosed at very early, not in early but in advanced stage. So these are the various diagnostic method by which we can diagnose colorectal carcinoma. So proper knowledge of the sign symptoms diagnostic tool is very much important, because proper knowledge of the sign symptoms or earliest sign symptom of colorectal carcinoma can help the subject or patient or individual for early diagnosis of the colorectal carcinoma, so as to they can go for checkup or screening for and to the concerned physician or surgeon, so as to prevent the development of advanced level of colorectal carcinoma in future. Thank you very much.